This is the third segment of the Head and Neck Module 2. It is going to specifically go into some detail on the cranial nerves. The purpose for this is that we are going to start the first portion of our course going into quite a bit of detail on the cranial nerves, and I want you to be prepared for the level of depth in which we will go. These are our same learning objectives. Again, we're going to cover the cranial nerves in this segment. What I've done is started with a video recording from Dr. Wayne Cottom, who is a faculty in the dental school here on the Mesa campus, and he nicely takes time to explain the differences between sensory, motor, and parasympathetic nerves. Spend some time watching this, and then I'm going to go into detail on a couple of cranial nerves, again providing you an example of the level of depth to which you'll be expected to go in this course.
This PowerPoint will review the three basic functions of cranial nerves. This PowerPoint is good to review before viewing the other PowerPoints that explain the functions and anatomical pathways of each of the cranial nerves. If you will recall, any cranial nerve can have one of three basic functions: motor function, sensory function, or parasympathetic. And some cranial nerves have multiple functions. If a cranial nerve has a motor function, that motor function can be either branchial or somatic. If a cranial nerve has a sensory function, that sensory function can either be general sensory, special sensory, or visceral sensory. And a cranial nerve can have a parasympathetic function. We put here visceral motor because that is another name for the parasympathetic function, and to remind you that the parasympathetic system is basically a modified motor system. We will now review the elements that must be present in the anatomical pathway when a cranial nerve has any one of these three functions. This is a review of the motor function of cranial nerves and demonstrates the elements that must be present in the anatomical pathway when a cranial nerve has a motor function. If a cranial nerve has a motor function, it must have a lower motor neuron cell body in a central nucleus from which its axon leaves the central nervous system and travels to the target muscle. It's important to remember that these motor fibers travel with the fibers from the other functions of the cranial nerve until they branch to go to their target muscle. So here you see an upper motor neuron coming down to synapse with a cell body of a lower motor neuron, which is contained in the central nervous system within a central nucleus. And the lower motor neuron axon leaving the central nervous system and traveling along its anatomical pathway to reach its target muscle. And that is a summary of a motor function of a cranial nerve. This is a review of the sensory function of cranial nerves and demonstrates the elements that must be present in the anatomical pathway when a cranial nerve has a sensory function. If a cranial nerve has a sensory function, its impulses are moving toward the central nervous system, carrying sensory information from the peripheral nervous system to relay in the central nervous system. The first order sensory neuron must have its cell body located in a sensory ganglion in the peripheral nervous system, and its fibers continue into the central nervous system to relay with a second order sensory neuron in a central sensory nucleus. It's important to remember that these sensory fibers travel with the fibers from the other functions of the cranial nerve until they branch to go to their area of sensory innervation. So we see here in the skin there's a first order sensory neuron that is bringing information from the skin in the peripheral nervous system, and those impulses are moving towards the central nervous system. The cell body for this first-order sensory neuron is contained in a sensory ganglion, usually with the cell bodies from many other first-order sensory neurons. And that neuron continues on to enter into the central nervous system and relay to the cell body of a second-order sensory neuron, which will then ascend up the spinal cord into the cortex, relay with a third-order sensory neuron, and deliver the information to the cortex. And that is a summary of the sensory function of a cranial nerve. This is a review of the parasympathetic function of cranial nerves and demonstrates the elements that must be present in the anatomical pathway when a cranial nerve has a parasympathetic function. If a cranial nerve has a parasympathetic function, it must have a lower motor neuron, now called a preganglionic cell body, in a central nucleus from which its preganglionic neuron fibers travel to a parasympathetic ganglion and synapse with the postganglionic cell body. The postganglionic neuron fibers then travel to the muscle or gland. It's important to remember that these parasympathetic fibers travel with the fibers from other functions of the cranial nerve until they branch to go to their target muscle or gland. It's useful to think of a parasympathetic nerve as a modified motor nerve, actually modified with a ganglion in the middle of what would otherwise be the lower motor neuron. And so you see here an upper motor neuron coming down from the cortex, sending impulses to relay or synapse with the cell body of a preganglionic neuron in a central nucleus. The preganglionic fiber or nerve then exits the central nervous system and travels to a parasympathetic ganglion, where it then synapses with the postganglionic cell body, and the postganglionic fiber then leaves that parasympathetic ganglion and travels to the target muscle or gland. And that is a summary of the parasympathetic function of a cranial nerve.
We'll start off with the trigeminal nerve, cranial nerve 5, as our example nerve and the level of depth. In this presentation, we're just going to focus on the first branch. V1 is what we usually call it, and it's the ophthalmic division of the trigeminal nerve. Now, the trigeminal nerve is the largest of the cranial nerves. It's primarily sensory, especially the first and second divisions, but the third division also does have some motor. It is going to go into the superficial and deep face. What's unique about it is as it divides, it's going to target organs that parasympathetic fibers go to. But if you'll remember, cranial nerve 5 does not originally carry parasympathetic fibers. What we find out is that it becomes the pathway that parasympathetic fibers, after they have synapsed in their parasympathetic ganglion, the postganglionic fibers jump on fibers of V1, V2, and V3 to go to their target organs. So we'll start with the ophthalmic division of cranial nerve 5 and then look at how a parasympathetic fiber from cranial nerve 3 rides with it to go into the eye. This picture is showing how cranial nerve 5 emerges off of the brain at the pons. It then has a sensory ganglion. Again, only cell bodies are there, no synapse occurs, but then it divides out into branch 1, 2, and 3. So in this top picture, we can see how V1, branch 1, the ophthalmic division, is going to pass through the superior orbital fissure and go up across the orbit in the eye and then out of the orbit onto the face to give general sensation to the forehead and lateral nose. You can follow the same path for V2 and V3. V2 is going to eventually give general sensation to your teeth and out onto your cheek and your nose. And V3 is going to give innervation to your lower teeth and general sensation out onto the chin. So if you're going to look at general sensation to the face, the picture on the bottom left is outlining which boundaries V1, 2, and 3 each have respectively. Again, when we're talking about general sensation, I'm talking about touch, pressure, temperature, pain, sensations that you feel all over your body. Cranial Nerve 5, Division 1, the ophthalmic division, is purely sensory. That's what GSA stands for, General Sensory Afferent. And again, when I'm talking about general sensory, the feeling of touch and pain and so on. Listed here are all of the structures that are going to be provided with general sensory innervation by V1. So you can see basically structures within the orbit, but then there are branches that go into the nasal cavity. So here is the cranial nerve 5 emerging off of the brain. It has the ganglion with cell bodies, and then V1 is going to branch off and go through the superior orbital fissure, and once it's in there, it branches. This is where you need to be able to know the level of depth that there are branches, what they are, and specifically what they innervate. Okay? So the first branch we have is going laterally, the lacrimal nerve. It is going to go and provide general sensation to the lacrimal gland. Going straight up the middle of the orbit, over the eyeball superiorly, and then going out above the eyeball to your eyebrow area are the supratrochlear and supraorbital nerves. So you can see that the supratrochlear and supraorbital nerves are branches of the frontal nerve, which is a fiber of V1. Supratrochlear and supraorbital are going to give general sensation to your eyebrow and forehead. The supratrochlear is going to be more medial, and the supraorbital is going to go straight up. The last branch of V1 is the nasociliary. It's going to ride in the medial aspect of the orbit. And as it emerges out, it will go to the superior external aspect of the nose. But as it's traveling along that medial wall of the orbit, there are small foramen that are, the nasociliary is going to branch and drop down through to enter into the nasal cavity. All right, so V1 is going to provide general sensation around and in the orbit as well as in the nasal cavity. You know that it has three main branches, what they then innervate. So that seems pretty straightforward. Now let's look at a nerve that is not as straightforward as the ophthalmic division of cranial nerve 5 because it has multiple functions. Cranial nerve 3, the oculomotor nerve, primarily does what it says. Oculo means eye, and motor means moves. So they're providing motor to the muscles of the eye. We'll go through that in specific detail here in a moment. So GSE on this slide stands for general somatic efferent. This is your voluntary muscle. GVE is general visceral efferent. You should be thinking parasympathetic. Okay. So now let's look at the picture at the bottom of the screen. Here's the midbrain. It is going to give off the oculomotor nerve containing somatic efferent and visceral efferent fibers. It is going to enter into the orbit through the superior orbital fissure. Often we abbreviate that as SOF. All things going to the orbit enter into it through the superior orbital fissure. Okay, so now keeping the motor component, we'll follow that first, the somatic efferent going to the muscles. Cranial nerve 3 is going to come through the SOF, that is then going to divide into superior and inferior divisions. So you can see the superior division is going to go to innervate the superior rectus muscle and the levator palpebrae superioris muscle. So superior rectus will make you look up, and levator palpebrae superioris is your upper eyelid, so it raises your upper eyelid. Whereas the inferior division is going to go to your medial rectus, inferior oblique, and inferior rectus muscles. Medial rectus allows you to look in towards your nose. Inferior oblique helps you to look up and out. And inferior rectus helps you to look down. Again, this is just moving your eyeball, not your head in those directions. This except LR6 SO4. Well, what does that mean? There are two other muscles of the extrinsic eye muscles that are not innervated by cranial nerve 3. They are the lateral rectus, LR, and they're innervated by the abducens, cranial nerve 6. And the superior oblique, which allows you to look down and out, it is innervated by cranial nerve 4, the trochlear nerve. But the majority of your nerves that move your eyeball are innervated by cranial nerve 3. Now let's follow the parasympathetic function of cranial nerve 3. That is going to leave the midbrain, travel along, come through the SOF, and then it's going to follow the inferior division, and it hops off. Every parasympathetic fiber has a parasympathetic ganglion where a synapse occurs, right? The parasympathetic ganglion for cranial nerve 3 is called the ciliary ganglion, right? So what I've drawn here in blue is all preganglionic parasympathetic of cranial nerve 3. After it synapses in the ciliary ganglion, we now have postganglionic fibers. They are going to jump on to V1. Look at that. V1 is sitting right here. We just talked about that. And remember, V1, the cranial nerve 5, gives the pathway for parasympathetic fibers to get to their target place. So again, going back to the purple synapses, we have the synapse in the ciliary ganglion. We then have postganglionic fibers from cranial nerve 3 called the short ciliary nerves. They are going to get into the eyeball by jumping on and traveling with V1 to help control the sphincter, pupillae, and ciliary muscles inside the eye. That helps to control the size of your pupil and then the muscles that change the lens of your eye. We'll go into that in more detail. But what you can see here is now we've introduced several different ideas. We have talked about preganglionic fibers of parasympathetic from cranial nerve 3, that synapse in the ciliary ganglion, postganglionic fibers that we call the short ciliary nerves leave that ganglion, jump on with V1 to go into the eyeball and do their action, which is efferent action of activating smooth muscles that affect the pupil and the shape of the lens. This is a schematic that shows the same thing that I just drew on the previous slide. Again, you have lower motor neurons leaving the midbrain, carrying motor to the muscles of the extrinsic eye. They divide into superior and inferior divisions and go to the muscles labeled there on the slide. You have presynaptic parasympathetic fibers leaving the midbrain, traveling on the inferior division of cranial nerve 3. It finds the ciliary ganglion where it will synapse. Postganglionic fibers leave the ganglion, join up with the nasociliary nerve, and are called short ciliary nerves to go into the eyeball. Now, the eyeball also needs sympathetic fibers, but we know cranial nerves do not, never, ever, ever carry sympathetic fibers, but they have to get there. Sympathetic fibers, remember, come out T1 through L2. They exit the spinal cord, they go to a chain where they synapse, and then postganglionic sympathetic fibers travel up with the carotid artery, finds the V1, and then it also travels with V1, the nasociliary nerve. We call the sympathetic fibers long ciliary nerves. All right? So this is a complicated example where we have a lot of fibers occurring. We've got motor to the muscles of the extrinsic eye muscles. We've got parasympathetic going to the pupil and the lens. Both of those are from cranial nerve 3. Sympathetic nerves join in. Those are called long ciliary nerves, and they use V1 nasociliary nerve to get to their location. So the purpose of this segment was twofold. One, to look at the functions of cranial nerves and how they are organized into different neurons. Where are their ganglia? Do those ganglia have synapses or not? That was from the segment presented by Dr. Cottom. Then we looked at two cranial nerves, cranial nerve 5, the ophthalmic division, and cranial nerve 3, oculomotor, to look at how these fibers work together and interact to take the function to specific structures and the level of depth at which we will go to within this course. If you have questions, please send an email or ask. We're going to then move off of cranial nerves and look at the neck in the next segment.